Hey guys, today I want to talk about the pectineus muscle. The pectineus is the smallest adductor that we have. It is the most cranially situated one. It performs adduction and hip flexion, and it is often extremely weak. Now, when the pectineus is weak, of course it can cause groin pain. However, it can also cause femoral neuralgia, compression of the femoral nerve. Now, why is that? Because especially in women, you will see that many women, they complain that they get numb in their anterior thighs when they are sitting, and especially sitting forward. The reason for this is that when the pectineus is extremely weak, it can lift the femoral nerve and push it into the inguinal ligament and compress it, and in the beginning causing femoral neuralgia. Eventually it can cause neuropathy. It can cause damage to the nerve. Okay. Now, I'm not going to go into the details about that, but it's nice to know about, and I will show you how to strengthen it, because it's a difficult muscle to strengthen. Because we have some big adductor muscles that really want to do the job for these little muscles. So let me show you how to do it properly. So you will sit, you do not want to sit in the position that is causing the femoral nerve compression, right? Especially if your patient has this problem. Generally, I only use this exercise for those patients, or like soccer players or whatever, who is having muscle-related groin pain. Now, the patient is sitting somewhat leaning back. The feet are together, and you want to slowly put the legs together, to slowly horizontally adduct the legs. If I go hard and fast, I will use the big adductor magnus and so on. I do not want to do that. It's a very slow, controlled movement, and you will see that it feels heavy. At least if you have that problem, you will see that it will feel heavy, even though you kind of feel like you're not really doing anything, and that's exactly what you want. Okay. You can also add a slight resistance with your hands outwards, but don't do that unless you feel clearly capable of moving your legs slowly together without getting any restriction, any unsteady movement or such. Now let me show you how to do it the easiest way first. So once again, my feet are together, my spine is neutral, I'm leaning back, and I'm slowly adducting all the way in. And even this, I can feel that, and I'm asymptomatic, I can feel that I'm getting a slight, almost to the degree of cramping in the upper adductor area. You see how slow I'm doing this? It's very, very slow. If you go fast, you will use the big muscles, and you will get no progress. Okay. Now I can also, as I said, add a slight resistant abducting with my arms. And only by adding, I guess I'm adding a maximum 1 pound of weight per arm. Still, it's feeling much heavier to adduct, to get the knees all the way together. So that is my exercise for the pectineus muscle. It is a difficult muscle to target because it's so easy to get contribution from the other bigger muscles. So you have to do it slow, you have to be in the right position, and you have to be somewhat flexed in the hip, leaning back so you don't get femoral nerve compression. I hope this video was informative. If you have any questions, please let me know, and I wish you all a nice day.